WJR. Good evening, everyone. I'm AnnMarie Cronin, and welcome to our live weekly medical show on News Talk 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is with us again to tell you what you need to know about how early screening and knowing your profile can lead to the avoidance of heart attack and stroke altogether. Pre-screening and simple non-invasive tests can actually prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls. So please make a note of this number, 800-859-0957. Again, that's 800-859-0957. This is your chance to talk to the doctor directly. So stay tuned and we'll be right back. You're listening to News Talk 760 WJR. And we are on Facebook Live, yes?
Yeah, we're on Facebook Live, for about 2 minutes before we come back.
Really? Yeah, we've only got 2 minutes.
Yeah, this is a quick one.
So, Siobhan, you're where? Virginia Beach?
We are in Virginia Beach today. Yeah, we have a show here tomorrow, so we got into town the night before, so we had the day off today, and then we play tomorrow in Norfolk, technically, but we came over to the beach to stay.
And see, lucky for Dustin, the singer, and lucky for you that you can just dial Kolender and get him to give you a prescription to take care of your sore throats and your setbacks.
Yeah, really, because, no, especially once we've been traveling for so long. Even Adam was having issues the other day with his neck. Apparently he has some herniated discs or something, but it's rough. Especially for people that travel, you don't have time to go to emergency room or urgent care or something, and then you're seeing someone that doesn't know who you are, your history, and it's like,
and then you've got to get back on the bus and move on. It's not like you're going to be there long enough to get anything, you know.
It's probably not the glamorous life, it seems like.
Right. Well,
no, but yeah, especially for medical care, once you've been gone for so long and, you kind of need somebody that knows your situation, you can get a hold of right away. Otherwise, you're spending the whole day figuring out where to go, who to talk to. And then you have to get a prescription and the day's over, the pharmacy's closed, you're moving on.
Right. That's really, it's a bad situation. 30 seconds. What are we talking about?
Vaccines.
Vaccines?
We're still on the anti-vaccine mandate. I've got notes today.
You do?
Good. We have a caller.
Welcome back, all of you listeners, to our live weekly medical show here on News Talk 760 WJR. I'm AnnMarie Cronin, and we are back again tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We invite you to call in if you have a question at 800-859-0957. Again, that number is 800-859-0957. Listeners, call in with your questions. Dr. Kolender, welcome. Welcome, Siobhan. I see that you've already got a caller. So should we take your caller first of all?
No.
No? All right, then let's have Dr. Kolender
we'll
start
kick off
with
the show first.
Yeah.
We'll kick off the show and find out the news of the week.
Well, I have an agenda, as always. So,
I'm afraid of that list of that long stack of papers there.
Well, the listeners should know I never have notes for a show. I really just go off the cuff. But as we get deeper in the weeds of why vaccine mandates are bad, again, my job is heart attack and stroke prevention. There's a very strong connection between our concerns and criticisms of how COVID's being handled and prevention. And the connection is the FDA. So we're all, not happy with how the government and policies are being handled and about treatments and lack of treatments and no early care and, what's available, getting the vaccines and whether they work, whether they're effective, whether they're safe. Same questions could be asked about why can't we get access to true preventive services. And At the end of the day, the factor, the group that's at the center, the log jam is the FDA. They're the ones that are holding up both ends to the benefit of the system, which makes money when you're sick. So when products are being sold, people are in the hospital, services are being rendered for illness, that's what makes money. And I hate to say it's all about money. So that's why we talk a lot about COVID on what really should be a heart attack and stroke prevention show. Because if you're this, and we go into this a lot on the Sunday show that we just finished recording 5 minutes ago.
That's on Sunday at 3 p.m.
Yeah.
for listeners.
And so if you've got thin skin, don't listen. But if the key is that the system is broken in every possible way. And that's why I talk about COVID. And it's really to wake you up to the system's broken and how do I find a way around it? It's not because, yes, I care about COVID, but it's the same problems are affecting prevention. And so now I'm really upset about these vaccine mandates on kids. And
Is that in place now, that it is passed, that it is a mandate?
it's again, nothing's changed in a week, but
Right.
it's the path is being set. It's just a matter of happening and being rubber stamped that COVID vaccines are going to be part of the normal childhood vaccine program, and that kids are going to have to get vaccinated in order to go to school. And again, it's not about vaccine or not. You need a choice. These should things that should be chosen. And in the UK, they recognize that natural immunity is widespread. And so they make the vaccine available, but not required. And so they've got better data about natural immunity. So even in groups of children where there's not a lot of vaccine administration, there's 95% naturally acquired immunity. So again, the vaccines are available, not required. In the United States, they don't have the data, but you've got to assume it's within close. And
So why, I just want to jump in and ask you a question before we get on to another subject. Why is the USA then not relying on data from the UK?
well, it's not a question of the data, it's the decision.
Well,
They
the
have
decision, but
the
it's obviously working.
What's working?
That they're not mandating it. They're not making it necessary to have to get this vaccine in order to continue on with school and life.
Well, we live in the United States, AnnMarie, and we're talking about what's wrong here. The UK is finally doing it right. They didn't start doing it right, but they learned,
Right.
and they're adjusting. And the United States is one size fits all. This is population medicine.
Right.
Let's do the same thing for everybody, whether doesn't matter who you are, where you are, what you're from, anything. You are getting the same damn vaccine, whether you need it or not. And no recognition that natural immunity has some value. And so why mandate something that has a remedy in place? It just doesn't make any sense. And I also want to, as we go on through the show, that I'll say most of my information that I get from vaccines these days is from somebody on YouTube named Dr. John Campbell. And if you want to go to his website, his YouTube page, very informative. He's prolific. I don't know how he stays on, but he just presents his information. And that's where I get a lot of my current vaccine data from. So I need to reference that. First of all, we're at the end of the segment, so we can't really do a caller right now. But we'll talk more in the next segment about, the FDA, the Pfizer vaccine, the Moderna vaccine, and how little data was obtained to make these decisions to vaccinate your children and grandchildren. It's embarrassing.
Well, I don't know if there's anything we can do about it, unfortunately, but let's come back and talk about that on the other side of the break. Again, you're listening to our weekly live medical radio show where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you would like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR. And we are back on. Who did we miss? Who's calling?
We had Greg from Shelby on the line, so he's a regular caller. But we
Yeah.
do actually have a question through the Facebook feed that's relevant here. Nina's asking, does my 18-month-old granddaughter need a COVID vaccine?
Well, again, the data does not support vaccinating children. It just doesn't. And we'll talk about this more on the show, but they're saying 6 months and up. So the studies are based on only 1,600 kids in the study. Of the 1,600, only 10 people got 10 kids got COVID during the study time. This is to identify the efficacy. Did the vaccine reduce negative outcomes? So within the study group and the time of the study, only 3 kids in the vaccine group got COVID. 3. They're making a decision for hundreds of millions of kids around the world, 25 million or so in the United States, based on 3 kids getting COVID who got the vaccine. And this is endorsed by the FDA. And really not enough time under pressure. There's not enough time. These studies are not big enough or long enough to identify safety. So essentially, no safety data, no efficacy data. They're still saying it's efficacious and safe. So this isn't me telling any specific person to get a vaccine or not get a vaccine. You've got to make the choice. AnnMarie, when you say we don't have a choice, you do have a choice.
Well, you cannot go to school. Is that what you're saying?
I'm saying that where there's a space for industry to fill a void, the void will be filled.
Right.
And so an industry will pop up to educate, to entertain, to provide for families of people that choose not to get vaccinated. And the reality is an overwhelming number of Americans do not want to get a vaccine. They don't want to get boosted and they don't want any more vaccines. So
Yeah.
how does it happen? It gets mandated.
I think the big issue is forcing young kids where it's totally not needed. I mean, I get polio and
Well,
MMR.
this is where we are.
If you're just now joining us, I'd like to let you know that we're welcoming you to our special weekly medical radio show on News Talk 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. After 20 years in practice and watching patients die prematurely and unnecessarily, he's here tonight to give you some hard advice on what you need to do to avoid heart attack and stroke altogether. We're inviting you to call in with your questions at 800-859-0957. Again, that's 800-859-0957. This is your chance to talk to the doctor directly. Dr. Kolender, we're talking about forcing people to, especially school-age children, to get the vaccine. We'll take the calls in a minute, but do you want to just start off talking about what's wrong with this
let's do the
picture?
call because that's a whole other segment where I'll rant.
all right.
So let's do the calls.
Siobhan?
Okay. Yep. So up first, we have Greg in Shelby. Greg, one of our usual listeners. What's your question?
Oh, you guys are awesome. Mr. Positive, Dr. Kolender speaking truth to power. And everybody, real quick, go see the Elvis movie. Got to ask you, Dr. Kolender. Yes, I'm a huge Elvis fan. Everyone knows. Prescription drugs. I've been dealing with a lot of people that I know that are being addicted to prescription painkillers. Do you think the medical field has any onus or burden or any culpability when this coming to this, or is it up to the patient? And what are the machinations that happen in the brain with painkillers?
Well, thanks for the question. And
You betcha.
there's a movie on one of the channels called Dope Sick, which kind of walks through the whole opioid drug epidemic. And my feeling is that this is another FDA failure. So they allowed a pharmaceutical company to change policy. I remember being in the hospital working when all of a sudden there's pain is the fifth vital sign. And so the hospital lobby bought into this, the FDA bought into this. Yes, an inscrutable family running a pharmaceutical company lied and cheated and told everybody that their drug wasn't addicting when it was. But we have an industry, we have a foundation of a system that's supposed to be protecting Americans called the FDA that failed us in that moment. The hospital lobby failed us. And so who's getting blamed are doctors for prescribing a drug that the FDA approved, that the hospitals were encouraging to be used. So doctors are being thrown under the bus for doing, what they're supposed to do, which is blindly follow the FDA. No one in the FDA got fired or went to jail for approving this. No, the family gets fined, God knows how many billions of dollars. I don't know if they went to jail or not. But doctors are being sued and thrown in jail. Now, I'm not defending doctors who are running pill mills, but being blamed for prescribing a harmful drug, we're all being told to do, if the FDA says it's okay, if the insurance covers it, it's okay. We're no longer holding doctors accountable on the show, but the system allows that. Why are we blaming doctors for the failure of the infrastructure?
Well, they obviously don't have enough power to overcome it. There's nothing they can do about it.
Well, who's the they? The doc. So to answer Greg's question, yeah, the system should be held accountable, and it's not. The doctors are being scapegoated. So I'm defending doctors.
Tonight for a
Yeah,
change, right?
right.
All right, Siobhan, do you have another caller?
Yeah, up next we have David in Windsor. David, what's your question?
Yes. The question is, my question for you, doctor, is this. Shouldn't the FDA and the World Health Organization and the pharmaceutical companies be held to account for the false information leading up to all these COVID viruses and heart attacks and strokes? And because I have a feeling that we are all being lied to by these pharmaceutical companies and the Food and Drug Administration and everywhere else in Canada and the United States about these vaccines. And I'm one of the people who is fed up and trying to look for some kind of action to take against vaccine mandates federally at camp and everywhere else, on buses and everywhere else. What is your take on that?
Well, thanks, David. Again, the reason we're interested in COVID is because, again, it's the same system. The rate limiting factor in these decisions is the FDA. And so the FDA is, at the end of the day, following these protocols. Unfortunately, no one in the FDA went to jail for allowing opioids to be marketed the way they were, as safe and effective when they were dangerous and deadly. So I don't really expect anybody in the FDA, David, to go to jail over COVID. Frankly, that's why the FDA wanted to bury the data on these COVID studies for 75 years, because by then they'd all be dead and they wouldn't be able to be held accountable for their crimes against humanity, which is exactly what they are. Before we go to the next caller, I want to try to stay on our thing about, these childhood vaccine mandates and remind people that the decisions to vaccinate children are really based on three kids out of 1,600 had COVID in the time of the study run by Pfizer. And so of those three, they didn't get hospitalized. That means the vaccine is efficacious. And because no one in the study died, again, that we know of, it's safe. Now, don't forget that children in the initial vaccine study left the study group because they became severely ill, had to go to the hospital, which excluded them from the study. And so they're not part of the safety data. There were kids documented out of the study. Again, I don't say documented officially because they're officially out of the study. They're suing the FDA. So there's not enough time or numbers of people to establish safety on these studies, but there it is, it's approved. And the Moderna data did not reach the World Health Organization guidance of 50% efficacy. So what does the FDA do? They lower the United States guidance to 40%. And now all of a sudden, the Moderna is good enough for kids. Lower the standard of care. That's our country, just to sell these damn vaccines. And if you think they're looking out for you, and if you think that you're going to go and get care when you go to your doctor and do the FDA prescribed process, you're out of your mind. Go ahead.
Should we take another call or
Yeah.
stay on the soapbox?
Do we have, okay, if we have a second, okay, so we'll jump to John in Riverview. John, we're coming to the end of the segment, but what's your question?
Hi. First of all, I'd like to tell you I love your program. Been a design engineer for over 30 years, and I was always about root cause to solve technical problems. So I give you kudos for what you're doing. Okay. My question is, I had a blood pressure problem that came upon me because I was silly and I didn't get my blood pressure tested, and it got out of control. Now I'm on, I forget the name of the pill, but it's a small little pill I've got to take like 1.5 every day, but it makes me feel a little bit woozy, off the bat. And my question is, if I were to become a patient of yours, do you have a plan where I could eventually get off of this stuff?
Well, thanks for calling and appreciate everything you're saying. We're going to have to talk more about you, and we will come back to you after the next segment because we're running out of time on this one. But we will address your question first thing at the beginning of the next segment. So
Good.
talk
It's
to
a
you
good
soon.
question. All right. In the meantime, we're going to have to take a quick break. Again, you're listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you would like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or you have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR. That was a good question.
It was. Well, let's answer him during the show because he's driving. He's not on Facebook.
Right. No, I understand. But still, it was a good question. It's like, if I join your practice, what's your plan?
Right. Well, it's a flawed question, which we'll get into.
Okay.
There's a subconscious thing driving the question, which is not, am I going to be healthy? It's how do I get off these drugs?
Well, who do you know that wants to be walking around with a bag of drugs?
It's still
nobody
does, but still the question is, what do I got to do to be healthy? And again, this is the misconception that's driving our system, which is I've got a pill for a problem, and so how do I get rid of the pill? The question is, what does it mean? It's what else is happening? Where's my health? How does this play in with the whole, infrastructure, what's going on with my body? None of these are being addressed in our system. It's just, this is the, you have the term for it, AnnMarie. This is the, the silos. This is the, I have a GI problem. I need a GI doctor. I've got a heart problem. I need a heart doctor.
Compartmentalization of medicine.
They're all tied together. Every single specialty is tied together in the process of inflammation.
Right.
And if you start to identify all the drivers of inflammation for different people, then guess what? A lot of things get better that you would not have expected, and you don't need a pill. But if you ignore all the things that led to these symptoms and go, well, here's a pill for the symptom, you're just taking a lot of pills.
I know, but I think that Americans have become used to it. They become inured to that having a bag of pills, a bag of medication,
Well, of course
because
they're used to it. That's what our
as
system is. That's
right,
all it
it's
cares
like,
about.
okay, eventually something's going to break down 1, 2, 3, 4, 5, and you're going to have pills for
And guess
everything.
what? Now there's a vaccine for every disease.
Well, not for every disease.
Well, they're gonna, believe me, they would like there to be one. They can't wait for more viruses to come up. They can't wait for monkeypox to blow up. All this stuff.
Well, that's how they make money, and this country is all about making money. That is all it's all about. There's no national health care. Sorry.
No, there should be.
Yeah, if the
That's all
government
there's to
was
it.
if the
There
government
should
was
be.
running it, it wouldn't be running this way.
Well, the government is kind of running it. They're endorsing the broken stakeholders. They're behind.
they're yeah
They're complicit.
they're running
instead
it,
of
and
being
that they've got shares in the company.
right.
They've got shares in the company.
They do.
Oh my
Well,
gosh.
again, we don't want to slander anybody on live radio, but somehow it's getting to them. I don't know how or where or why, but it's getting to them, whether it's through grant money, research grants, speakers, you just don't know. Whether it's through election contributions, it's getting to them. I had a patient tell me there's no way that there's these bribes this way, but they're not bribes, they're election contributions.
Right.
Mhm.
Sort of same thing.
Well, the Supreme Court, in all their wisdom, has made that legal.
Welcome back to our special live medical broadcast on News Talk 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention here tonight to give us some straight talk about two important topics, prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, just before the break, you took a call from John who had a specific question. Please go ahead and follow up on his question.
Well, thanks. So, John, the question is, in my mind, isn't how do I get off these medications? The question is, where is my health? What is my risk of events? And what do I have to do to not have a preventable outcome? So if we're telling you that heart attack and stroke is preventable, how do we stop that from happening? Not necessarily how do I get off your medications. Now, if you're taking a medication that's giving you a side effect, then that may not be the right medication for you. So we want to find medicines that don't have these side effects because that shouldn't be happening. That's number one. And then the rest of it is, again, identifying your risk. And that means getting imaging, getting a carotid intermediate thickness test, measuring the layers of your artery wall that predict risk of having an event, looking for other vascular markers that represent chronic disease, get a coronary artery calcium scan if you have to, meaning if your CIMT is normal. We still have to keep looking for plaque because it's common. And then address all the drivers of disease that cause these things to happen. So not a good idea to ignore your blood pressure. I agree you shouldn't be on a pill that gives you side effects. There's a lot of blood pressure pills. Find one that you can tolerate that doesn't give you dizziness or weakness and lowers your blood pressure.
So therefore, what he really needs to do is understand that he needs to be in the type of practice that you're talking about right now, where you look at everything.
Right. Well, the question is not how to get this pill. The question is, how do I not have an event? How do I not die?
Yes.
That's the question, not how I get this pill. How do I not die?
Yeah, and the big issue is just trying to make people understand that they're all unique and they all have their own profile, and you need to do these, investigative tests in order to find out exactly where they stand. And the big issue has always been all along is that they're not covered by insurance, but they're also not very expensive. And so it's kind of like, what's your life worth? Siobhan, you have calls backing up. Who do you have calling?
Yeah. So maybe we can. So up next, we have Pat in Richmond Township who held over the break. Pat, what's your question?
My question is, this is kind of off tangent, but Charlie LaDuff did a study, and it showed from June 2020 to June 2021, the number of COVID deaths in the state of Michigan were 14,700. Now, keep in mind, the vaccine was introduced around December of 2020. And so that year only had like a 6-month period for people to get vaccinated, and its startup was rather slow. So basically, you didn't have any vaccine that year, hardly going on. And then June 2021 to June 2022, we had 16,000 COVID deaths. And now, I mean, when you look at how a pandemic goes, normally it starts to wane and go down. But the vaccine introduced had the luxury of having all the low fruit picked, so to speak. All the vulnerable people got knocked off the first year. And furthermore, you had herd immunity taking place. So the vaccine's introduction had tremendous advantage to be a rousing success. The fact that 16,000 people, it went up instead of down, shows the inadequacy of the vaccine's effectiveness. And I just don't buy some of these things that people say, well, they lowered the masks requirements, or they start letting people move around more. It just doesn't add up, in my opinion. I just wanted the doctor's opinion on that.
Well, thanks for calling. So I'm not familiar with that particular study, but the idea to me is that we adapt to the situation. And in the beginning, we had no vaccine. People were dying from COVID, and we needed something. And, regular listeners will know I was promoting a vaccine way back when, and I recognized we didn't have the data. It wasn't being presented to us. And I was hoping that we weren't being screwed over by the government. And once they mandated and simultaneously approved a branded version of the vaccine, which are philosophically opposed actions, then I said, okay, they're trying to kill us. And that's when I stopped and said, okay, we need to be a little critical, or a lot critical. Again, I'm going to refer to the United Kingdom and who's adapting to the situation. The government is not adapting. The United States is not adapting. The CDC, FDA is not. They're just saying, let's move ahead and mandate these vaccines, and all logic thrown aside. And that is what's not good. And that's where my problem is.
All right, let's move on. Siobhan, you have another caller?
Yeah, we do. Up next, we have Danielle in New Jersey. Danielle, what's your question?
And Danielle, by the way, did send in her question last week. She was going to call you, Dr. Kolender. You'll remember she's
Yes.
a
Thank you.
Star follower. So go ahead, Danielle. What is your question?
Okay, yeah, it's pretty off topic to tonight's segment, but recently my psychiatrist retired. So I've been on Zoloft SSRIs since I was like 17. I'm like 35 now. I know they work by enhancing your serotonin levels and stuff. I've also been reading a bunch of different things written by doctors and books and stuff about how healthy eating and your serotonin is mostly produced in your gut. So I feel like that's a good thing. Like food can kind of cure a lot of ailments that we have, like from depression to help with diabetes and all that. So rather than pills, like the pedal pushing of the pills for this, pills for that, I wanted to get off the SSRI and use diet alone to try and like fix myself, kind of. So the question is like, how would you recommend like dealing with the withdrawal from getting off those kinds of medications?
That's just an excellent question. There are so many people that are addicted to these psychotropic medications and they're on them forever. And they're more harmful in the long run than good. So, Dr. Kolender, what does she do? What does this patient do?
Well, thanks for calling. First thing is, I agree with what you're saying, which is gut health does generate all of the neurotransmitters in our brain. So most of the serotonin is made by our microbiome. So you want to optimize your microbiome first. So non-inflammatory foods, which are mostly plant-based, green leafy vegetables, sweet potatoes, root vegetables, and anything in the cabbage family, that should be the bulk of what you eat. And then there are some supplements, which I'm not going to get into right now, but there's some supplements that can help support gut health. And then once you're kind of going on this diet, you want to wean off the Zoloft slowly, like over minimum 3 weeks. And since you've been on it so long, I'll wean off of it maybe over 6 weeks.
But who monitors her during that process?
Well, I mean, you got to have a doctor, who's with you, whether it's your PCP or psychiatrist, so that if there's a problem, you can get some guidance on, what to do. But I expect you to do fine. What I find is you got to watch yourself 3 to 4 months later, because that's how long it takes for your brain to unwind from the medicine. So if things start going haywire 3-4 months down the road, you might need to go back on it or on some other medicine, because psychiatry is complicated. So
And her psychiatrist gone, not available anymore, so she's dependent on the PCP. Good luck with that one. Anyway, enjoy the Baltimore show with Starset. We got to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subjects we're discussing and you'd like to hear from the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR. See, that's actually a great question, that people that go and they get put on these, psychiatric medications and then they're just left on them forever. And then if they want to get off them, her psychiatrist is gone. And then what does she do? PCP is not going to see her or do any good.
Well, I'm going to say in simple, if there is such a thing, but simple patients who have only need one medicine, I do try to manage them because I recognize they just can't get into a psychiatrist. And
Right.
so SSRIs do handle most people. So most people have, I want to say, mild cases of depression that you can manage or anxiety. And, with either a low dose benzodiazepine, which unfortunately can be a little addicting, and a SSRI type drug. And there's no reason to have a psychiatrist for that if it goes well. The problem is if things go bad, your life falls apart, and then it takes 3 months to get into a psychiatrist.
If you're lucky to find
If you're
one.
lucky to find one. So,
I mean, they're just not out there. That's the problem.
well, this unfortunately is part of our system not taking care of us. And again, self-care, which we've had many shows on, is a very important part of taking care of ourselves and prevention. And if we had access to specialists early on for support, talk therapy, learn about why you're having the feelings that you do and the thought that you do, then maybe we'd be averting half of these cases of people having debilitating anxiety and depression.
Mhm.
If we got them as kids,
Right.
10-year-olds, 15-year-olds. The problem is you just can't, it doesn't exist, like you said. So everyone's being ignored. Teenage suicides up because there's no care. There's no attention. The parents don't know. And then next thing, then you're left with overdiagnosis of bipolar. That's the other thing.
Right. Or just being, into the system where you're just being thrown into a psychiatric clinic where you're seen by a PA that's got a
Well,
prescription pad.
again, I'm not a psychiatrist, so I don't want to do this, but you've got to wonder that so many people are being diagnosed with bipolar disease is because the diagnosis was expanded so greatly to include a lot of people that were previously just depressed.
Right.
And then they're being put on these antipsychotic drugs because it's indicated for bipolar. And this is not the first time the FDA has expanded a diagnosis so that a drug could be prescribed. And this is the the organization that's here for us. It doesn't sound like it.
What's the hope at the end of the day?
We got to overthrow the government.
Well, okay, good. The Russian Revolution, the French Revolution, and now the American
Well,
Revolution.
We're going.
How about just national health care?
Well, that's where we're going. Meaning we're gonna promote a legal overthrow of the government. That's where the show's going. A legal overthrow of the government. So hopefully we start talking about this sooner than later, but that's the plan.
Welcome back to the final segment of our special weekly live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that number is 800-859-0957. And also, listeners, don't forget to tune in Sunday at 3 to listen to our weekly show with lots of information. Dr. Kolender, final segment. How can we wrap this up? It doesn't seem to be, I don't know. You hear more and more calls from people, whether it's psychiatric call, being too over-medicated. What's the answer? You're one doctor.
Well, I'm not going to answer that question. I was going to come back to where we talk about, which is making the decisions for yourself. Again, if you want to choose a prevention plan, you've got to leave the system to find somebody who's practicing true healthcare prevention to find on your own, because the system is horribly damaged to your detriment. So that means you've got to ignore the process that everyone's doing, find another one that will lead you and shepherd you down the path. And along with that decision, again, and we want to talk to the parents and grandparents of young children up to 26, when, even when they can make their own decision, that it should be okay to choose not to get vaccinated when the data does not support efficacy or safety, even though the FDA has approved it and the CDC has endorsed it. The data does not support it. And there's so much data out there about natural immunity. We don't know that natural immunity anymore is better than vaccinated immunity, but that's not the proof of burden. The proof of burden on the government is to show that vaccinated immunity is better than natural immunity. They cannot. So if you cannot prove that the drug that you have is better than the control group, you cannot morally put it out there as a mandated product. They cannot prove that being vaccinated provides better immunity than natural immunity.
But at the end of the day, if it's going to be mandated, it's going to be mandated. And what's the public supposed to do? What's the average person supposed to do? I mean, if you mandate vaccines for children that are supposed to start school.
There are many parents out there who've declined vaccines for their kids. They still get to school. They still, go to college, and it's camp season, and I'm kind of connected to the camp world a little bit. And these kids are being denied access to camp, just like David can't go on his vacation because he's not vaccinated.
Right.
And so there's, it's an assumption that vaccine prevents severe disease. There's no support of that. is none right now. You have a call, Siobhan?
Yeah,
Siobhan?
yeah, we do. Let's jump to the caller. We have Carol on the line calling from Naples, Florida. Carol, what's your question?
Doctor, I've been on Repronerol for a long time for restless leg syndrome. I was wondering if there was any natural components that I could use to wean myself off of this.
Well, restless leg syndrome is a sleep disorder, and and sleep is a critical component to prevention. I wouldn't do anything without being under the care of your sleep doctor to make sure that whatever you do is leading to the result of you having good quality sleep. And so that's my caveat there is that we do that. Now, how do you promote better sleep? Regular exercise, healthy eating, just like we talked about, having a good bedtime routine. Now, again, you have a sleep disorder. And so you need to optimize all these other areas of your health the best you can before you start thinking about weaning off a drug. And again, under the care of a specialist.
Sleep doctor important. Maybe she wasn't ever told about that she needs to be under the care of a sleep doctor because so few PCPs or even specialists talk about that. But before we run out of time, Siobhan, you've got another call.
Yeah, we now have Suzanne in Livonia on the line. Suzanne, what's your question?
Hi there. I've got a college freshman that's going to a university here in Michigan, and I want to ensure that he doesn't have to get the vaccine. What can we put on his waiver because they're demanding he gets the vaccine when he stays on campus? It's concerning, very concerning.
I wish I had an answer for you, and I don't. I don't know that there's anything you can put on there. But again, this is what we just talked about, that natural immunity should be a vaccine exemption because it's as good as being vaccinated. And unfortunately, there's decisions and choices to make.
Let me ask a question here. This is being stopped at the university level. People can't get into college now. What college is it he's going to?
He can't stay on campus. He can go if he didn't stay on campus. It's Eastern Michigan University.
I see.
And we don't have a positive COVID test either yet. We don't have one, so we can't even prove he had it.
Well,
So we were going to go with giving him studies. There's studies everywhere saying that it's not a good thing for him to have it and such. But whatever you said, let me know what you think.
Well, I would say let's get off-campus housing. That's all. You can go to school, you can have your friends. I would do off-campus housing.
Depends on how far away he lives. You don't know. He might be
Well,
coming.
there's
Well,
there's
they're close. They're in
off-campus
town.
housing
Yeah,
there,
that's
right?
true.
So, get an apartment a block off of campus. That's all. You just can't live in a dorm.
That they demand that you have this vaccine in order to go to school when it could kill you. I get what you're saying to work around it. I just think it's kind of cruddy. And he lives 30 minutes. I live 30 minutes away, and he wants to stay on campus. So
Yeah,
he could stay home for sure.
It's immoral. It's not just cruddy. It's immoral to mandate a treatment that is not better than the control. And so, and you say you don't have a positive COVID test. There's enough data out there to support that most people in his age group have been exposed to COVID and have well, here's the other thing. Antibody serology, which is the blood test we all get, does not predict your immunity. I have still patients come to me and go, I want my antibodies to see if I'm still immune. It doesn't matter because the immunity is being stored in your bone marrow with B cells, T cells, and these are done through sophisticated studies. And so we know that that's where it's stored. There's no connection between your natural immunity and your COVID antibody results. So it's useless to get a COVID antibody result. Yes, it'll say while it's positive, you're immune, but it'll go away, you're still immune. So unfortunately, there's no one to talk to because the pediatricians are on the boards of these camps and schools, and they make money giving vaccines. There's no independent thought here. Everybody making the decision for you to get a vaccine or not is on the payroll one way or the other.
National health, that's it. There isn't any other answer in this regard, but we're out of time now. So I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope that you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Thanks to my co-host, Siobhan Cronin. Please continue to tune in to our shows Sunday afternoon at 3, Thursday evening at 7 for the latest medical updates. And thanks for listening to News Talk 760 WJR. Good night and be well.